I'd like to talk to you about the Movember campaign that you might have seen out and about, where men during the month of November grow moustaches to increase awareness of conditions that specifically affect men across the world. Some of the conditions that are quite unique to men are testicular cancer, prostate cancer, as well as men's mental health. And it's important that we talk about these things and increase awareness to help save lives and improve the quality of men's lives worldwide and here in Dubai. When it comes to men's mental health, there are some differences in the way that a man might present if he has signs and symptoms of depression or other mental illness. So whereas for ladies, they may come across as quite sad and low, men can typically exhibit depressive behavior by increased aggressiveness and also risk-taking behavior. They may frequently feel that something's not quite right, but they're not quite sure what it is. So if you do feel that yourself or a close friend of yours is exhibiting symptoms of a change in behavior in any way, and you're concerned about their mental health, it's very important that you do visit your family medicine doctor to discuss these symptoms in more detail. There is plenty of help available, and that can be in the form of either medications, talking therapies, self-help guides, and a combination of all of these above. Prostate cancer is the most commonly diagnosed cancer in men. It's also one of the most treatable and preventable if picked up at the right time. It's important that if you do notice any symptoms where you have difficulty passing urine, if you have back pain, if you see any blood in your urine, that you do go see your family medicine doctor to discuss these symptoms in more detail. Particularly if you're over the age of 50, or if you're above the age of 45 and you have risk factors including a family history of prostate cancer or are of certain ethnic backgrounds. Prostate cancer can be diagnosed, or we can find out more information on whether prostate cancer is actually the underlying diagnosis by doing what was called a prostate-specific antigen test, or a PSA test, which is a simple blood test that can be taken from a patient, and increased levels may point to an increased likelihood of prostate cancer being present in the individual. This can also be combined with a physical examination, and the two of them together can increase the sensitivity of such a condition being possible. When there is any suspicion of such a test, then we will be referring you to our world-class urologist based at the King's College Hospital in the Dubai Hills for further investigation and treatments.